Many patients I see come to me with frustrations about their acute injuries or the fact that they're experiencing pain or discomfort, or perhaps that they're unable to do certain activities that they have really enjoyed doing as a result, again, of perhaps a surgery of some type or some form of acute injury or deconditioning of some type. And today, what I wanted to talk about is, I think, the importance, so to speak, of really having a long-term vision when it comes to the rehabilitation process. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And my purpose and passion is helping patients to regain their strength, mobility, and conditioning in the comfort of their home. Today, I wanted to talk about the importance of a long-term focus on functional goals as part of the rehab process. So again, as I mentioned, for a lot of patients, there'll be, and again, I can really empathize with, but there'll be this real focus in on whether it's a pain component, whether it is a lack of mobility, a lack of being able to do specific activities, and again, the impact on their lives. And I think what's really important in terms of, looking at the rehab process is that there's specific steps involved to it. And I think for a patient, having that long-term vision of what are those specific long-term functional goals can really be helpful in terms of motivation and in terms of helping patients really to understand that it is a process, and that there, to some degree, there's going to be a sense of patience that needs to be involved in this. But to really understand the stages of the rehab process, it can be really, I think, important. So, the first stage, when I look at somebody who might be, for example, post surgery, and again, they might be having these specific limitations as a result of the surgery that they have had, is, the first key is really going to be to focus in on mobility and strength, right, around that specific area. So for example, if it's somebody's had maybe a knee surgery, a total knee replacement, the real focus is going to be on trying to regain that mobility and strength. And then from there, in a lot of cases, we want to work towards more functional, weight-bearing, day-to-day type activities, right? So that could look like something along the lines of a proper sit to stand, getting out of bed, proper gait pattern. So really moving from very specific around the knee joint to now becoming more functional in terms of how this might impact and where we need to improve in terms of day-to-day activity. And then the final key, right, and this is a big component of the subjective history when I'm trying to work with a patient, is really understanding what their specific movement functional goals are. So that might be, hey, I want to get back to gardening. That might look like, I want to be able to enjoy time with my grandchildren, or I want to get back to dancing, or just even day-to-day housework to really try to maintain my independence. So with that in mind, that is sort of the vision, right, for where the rehab process is. And I really try to encourage patients really to have that end goal in mind as we're going through the different stages, which in the rehab process can, and again, I can certainly have a lot of compassion and empathy for individuals in terms of this process can be uncomfortable. It can be long sometimes. It can be frustrating. And again, I think as an important reframe, having that vision in mind can really be helpful as a motivating factor for patients to continue on their rehab journey. If you're somebody who could benefit from in-home physiotherapy, you might be struggling again in terms of not being able to do those specific goals, those functional movement goals that you desire. Feel free to reach out. I have my information below, linked to my video here. And please make sure to check with a physiotherapist to make sure that this or any other information is appropriate for you. Thanks again for watching, and have a great day. Take care.